Let's see if it works this time. Yay. Okay. So when we had this massive over deinstitutionalization back in the 60s, 70s, and over time, there was this huge push for civil rights and the fact that they thought everybody would be better off in the community, and that it was really wonderful that we closed all of our state hospitals or really substantially closed them down. The thing is that we have to be communicating that it's not wonderful for everyone. There is a huge amount of suffering still happening because we don't have state hospitals at the level that we need them for our loved ones. And not that everybody needs to be there, but we need that level of care. Okay, so next we're going to be talking about state beds and competency restoration. And this is a quote from Lisa Daly. I had been talking about this fact that we had over deinstitutionalized and talking about how we still need state hospital beds in a social media post, and I used way too many words. And Lisa made one comment: fix them, don't nix them. And I just love that because it's so succinct. And I so wish this had been what was in people's minds back in the 60s and 70s when we started closing things down. That's Lisa Daly, our executive director at TEC. Okay. So state hospitals offer unduplicated services. And it's important to know that most of the hospitals across the country are really private, about 82% of them. But we do also have state hospitals that are publicly operated and funded. They're primarily funded by the state governments themselves. The problem is that even though we have a lot more private hospitals, they will not admit people for extended periods of time for the most part. And they do not admit people that are mandated to get treatment because they've intersected with the criminal, legal, or forensic system. And state hospitals can offer long-term care that no other facilities do provide. So we are seeing a huge decline in bed numbers, right? And why do we care about this? Because we know that based upon SMI prevalence, for about every 100,000 people, we should have 30 to 60 inpatient beds for a functional system. Now, please note that's both state beds and private beds in your state. You should have 30 to 60 of them for every 100,000 people. And no state in our country has that availability of beds. And because of that, we see people going through the revolving doors of the SMI churn with repeated too short hospitalizations that are ineffective, they're homeless. And it means that so many people end up having an average duration of untreated psychosis, which is 74 weeks long. It's just unconscionable, right? And again, while untreated, that brain is getting more and more brain damage, and their life circumstances are getting worse and worse and worse, right? And in some states in our country, the only way somebody can get into a state hospital is through that criminal legal system. People will be told, well, you need to let your child commit a crime because then we can get them to the state hospital and they'll get treatment. That's not good advice. um, And I want to point out that competency restoration is not treatment. It's a forensic mental health service that is part of the criminal legal process. If somebody is deemed by a judge to be incompetent to stand trial because they're not with it enough, they're not in reality enough to be able to participate in their own defense, they will send them for competency restoration. And when we're new to this, we think, oh, thank God, finally my loved one's going to get treatment, right? But the thing is, it's not full treatment. It is medication enough to get somebody well enough to be able to take these classes about courts and understand that they're in a courtroom, that there's a judge, that there's lawyers. It is not full treatment to where somebody becomes well and able to manage their own care. And the problem is that if somebody's sent for competency restoration, and maybe by that time, their time of their sentence has already been served, then they're sometimes just released with no connection to treatment in the community. And unfortunately, in one of our reports about a year ago, what we found during 2023 was that there were a total of 5,576 people sitting in a jail waiting for admission to a state hospital just to get their competency restored. And the average length of time was 60 days sitting there untreated in a jail waiting for that competency restoration. And as a result, many states have faced class action lawsuits and they've started doing things to work on their competency restoration systems, which is great. In January last year, we published a prevention over punishment report. It really was an update of our beds report that we had done 10 years earlier, but they decided to change the title and focus of it to prevention over punishment because of how many beds are no longer civil state hospital beds, but are actually being utilized for competency restoration, forensic beds. And what we found is that there's this huge shortage of state psychiatric hospital beds. No surprise to any of you, okay? And this graphic does a really good job showing that over the years since we were at our peak in 1950, the number of beds per 100,000 people has really plummeted. And I do want to say, back in the 50s, we had way too many people in state hospitals. That's absolutely true. But now we are really substantially underbedded. And it used to be that it was thought that the normal ratio should be 50 beds per 100,000 people. This report gives you the data where they got this information about where it should be a minimum of 30 beds per 100,000 people, but ideally 60 beds per 100,000 people. It's a handy report I wanted to make sure you knew about. It's going to be in your study guide because it's a good report to be able to go and reference. Now, in addition to that big report, we also have a supplement that covers each state individually. So I pulled up the Colorado page. And to those of you attending from another state, there's a page just like this for your state. And the beauty of this page is that it shows you very specific information for your own state about where you are. In the first half of 2023, Colorado had 482 staffed state hospital beds for the adult population, right? And that's the thing to know is we're talking adults in these bed reports. And there's a whole lot of other information that's on here. How many forensic patients are there? How many patients are ready for discharge but can't go anywhere because there's no long-term housing for them to be discharged to? So there's a snowball snag in the system. If we're holding people in that state hospital bed for too long, it means behind them we are limiting people and keeping people in regular hospitals for too long, waiting for those state hospital beds. And because we're doing that, then somebody presenting with a new problem can't get into that acute care hospital, right? It affects the whole system when there's a clog anywhere in the system. On each of these pages as well, it shows you where the state hospitals are and how many beds they had in 2023 that were being reported to our staff. Okay. We also provided advocacy recommendations about what to do about this huge problem. We really recommend that states take a look at balancing the need for both forensic and civil beds, right? We need people not to have to intersect with the criminal legal system in order to get into a state hospital. A lot of the beds are way too few because we can't even staff them all. That's a big reason why you'll see reports often showing you your staff beds versus your licensed beds versus what you should have. Um, and that's a problem because we don't have enough workforce. So we do have to do things to address recruitment, retention, and training because it's really hard to work taking care of people with SMI if you don't know what you're doing. And so people burn out and they turn over. Definitely need to increase reimbursement rates. And we really push that there has to be data tracking to look at the state hospital bed numbers, wait times for discharge, and competency restoration. Because how are you going to fix the system if you don't know where the biggest snags are, right? The biggest limitations. And you can be part of providing this information to your legislators. You can send them the beds report. That's a very simple thing to do. Send them these reports. Another report that was released after that was called Our Stories Matter. It was more of a qualitative summary than it was a research report. And it was something where the people at TAC that were producing this report by Shanti Silver, they reached out to people that had already been connected to TAC and said, we'd like to hear about your experiences or your loved ones' experiences at state hospitals. And several people from around the country submitted stories. This was before I started working for TAC, and I went ahead and responded to that to share our experience with our son in Iowa because I knew from being connected to so many people across the country that most of the stories would be horrific. And they are, right? There's a horrible, abysmal situations at some of the state hospitals in our country. But it wasn't the case here. In Iowa, we only have 64 adult beds. We are 51st in the country for our state beds. But at the beds that we do have at our two state hospitals, they give good quality care. And I wanted to provide that counterpoint so that people could understand that yes, there's bad care in some of these places, but it's possible to do this well, and that there's still a need for that long-term, comprehensive, multidisciplinary care for a lot of the people in our country. Because otherwise, if you don't share the positive examples, people's answer to it is going to be what it's always been: shut them down. We can't shut them down. We need that level of care desperately. Quality of care needs to be addressed. It can't be just that we add beds, right? Can't just add a pill in a bed. That doesn't do it for our loved ones. We also need to be addressing the need for increased quality of care. And we have to address the staffing shortages. And we have to also address the fact that many of these state hospitals treat people for forensic needs very differently than they do when they come in on a civil commitment. And the problem is that's because it's bad because they assume that the people coming in the forensic system for competency restoration are criminals. But they aren't. They're just people that have gotten sick and have been failed by the system and haven't gotten treatment. And that's the reason why they have committed some crime that's caused them to get there. They're the same people, right? And we have to be able to tell our stories to help educate the legislators that that's the case. These are people, they are not criminals. They're people we have failed. Now, on our website, we have a lot of different information at TAC, and I really encourage each of you to explore it. If you go to the resources and research area on the website and click on there, you can come to this map of the state resources, and then you can go click on your own state, and it will bring you to your own state's information, where you will find information like this. And when you get on that page, you're going to want to make sure you scroll all the way to the bottom of the page because it's a long page and there's a lot of different information. Again, I picked Colorado because most of you would be from Colorado, and it shows you the same kind of graph, but just for your own state. Back in 1955, you guys used to have 5,720 beds, and in 2023, you have 482, of which 192 are civil and 290 are forensic. This is what they're reporting. Reality might be different, but that's what they're reporting, right? So it gives you a snapshot of information there so that your bed count for your state beds is 8.3 per 100,000 people. Now, if you really want to have an idea of where does that fit in that number of 50 per 100,000 people, you need to figure out your number of private hospital beds also, add that to your state beds, and then do the math. But you have a problem in terms of too few beds, just like every other state. There's a link to that other Colorado page that I showed you before that's right there. But also, if you keep scrolling down, it shares other information for you, like the prevalence of SMI in your jails and prisons. You have an estimated, or had in 2023, an estimated 5,812 people who had SMI in the prisons. And in state hospitals, only 482. So you can see that you have a 12-to-1 chance or likelihood of being incarcerated versus hospitalized. That's just